So in our previous OpACIN-neo trial, we already did some biomarker analysis, and we found that both the interferon-gamma signature and tumor mutational burden were independent biomarkers for response, pathologic response, and also for relapse. The aim of our investigation for this poster was to confirm the interferon-gamma signature and TMB to be independent biomarkers. So what we found in the Prado trial is that the interferon-gamma signature was significantly different between patients who achieve a pathologic response versus no pathologic response, and also significantly different between patients who achieve a major pathologic response versus no major pathologic response. And when we order the patient from low to high and define the most optimal cutoff based on a receiver operating RRC curve, we find that the pathologic response rate for patients with a high interferon-gamma signature was 87%, and for patients with a low interferon-gamma signature was 50%, and the MPR rate was 77% versus 35%. We also found that the event-free survival after 2 years was significantly different between patients with a high and low interferon-gamma signature, with 87% event-free survival for patients with a high interferon-gamma signature and 68% for patients with a low signature. When we then look to the tumor mutational burden, we also saw that the tumor mutational burden was almost significantly higher for patients with response versus without response, and significantly higher for patients with major pathologic response versus without major pathologic response. And after defining the most optimal cutoff, we found a pathologic response rate of 83% for patients with a high TMB, and also a major pathologic response rate of 83%, and a pathologic response rate of 57% for patients with a low TMB, and a major pathologic response rate of 34%. However, when we look to the event-free survival of the patients according to TMB, we did not see a significant difference between the patients with a high TMB and low TMB. The 2-year event-free survival rate was 81% versus 73%. And this is possibly owing to the fact that the patients are treated with different surgical and adjuvant treatment regimens after they achieve a response. So that can blur a little bit the effect of our baseline TMB as a biomarker.